I think we're going to get started with the next section. So, what I'd like to talk about here is just the processes, how I incorporated this device, which is a great device, but then, we got to make it work in our clinics. That's the bottom line. So when I first got Envision in my clinic, I had three big concerns. Concern number one is, this is an expensive device. I hope this thing works. That was fear number one. Number two is, can I do these? Like, am I going to be able to do this? Is it complicated? How am I going to do these processes? And again, this is back in 2019, and there weren't people to go to. So thank goodness there were events like this that I could go to, and I could ask questions. I talked to everybody I could. I asked, how do you guys do this? How do you do Morpheus? How do you do IPL? When do you do it? How do you treat patients that have this condition or that? So this is an amazing opportunity to talk to a lot of different specialists about what they do. So take advantage of that. So that's what I did. And then thirdly, how do I get patients to pay for a procedure, especially when they're asymptomatic and they walked into my clinic and they had no clue they had dry eye, and I have to now diagnose them, show them they have dry eye, and get them to self-pay in Canada, of all places. Trust me, this is a difficult thing in Canada. So I'm going to talk a little bit about this. I'm just going to go through some quick slides here. Obviously, in optometry and ophthalmology, our main source of income is exams, glasses. In ophthalmology, it's procedures, doing different kinds of different surgeries. So these have been the models that we all kind of have. Obviously, I have a dispensary. I have 3 licensed opticians. I want to keep my dispensary running. I don't want this to take so much time in my office that I can't see the regular number of patients. That was a big concern I had when I first started doing this. So obviously, all of us are under a little bit of pressure, mostly from chains, online glasses sales. So when I saw this opportunity, to me, this represents something my patients can only come to me to get. This cannot be done online or virtually. I can't lose my patients to an online vendor. This is going to set me apart from all the other people that are just doing, just optometry with glasses and with eye exams. I want it to be set apart. And it has worked really, really well to kind of specialize my clinic. And I think that's what kind of all of us are doing. And I've been very impressed by the people I've met here. This is a very savvy room, people asking really great questions. I think we're all very much of the same mindset with our practices. We want to give the patients the best we can give them, and we want to set ourselves apart. So I see when you buy Envision, it's really, to me, there's an evolution that happens. You start simple, and then you get good at that, and then you start doing different things. So when we started, my intention was to be a dry eye center of excellence. That was my intention. That's why I got Envision. Obviously we bought it for that reason. What was interesting is, after having this for 2 years, my patients were really pushing me to do aesthetics. And I don't mean subtly. They're like, I want to come every 3 months. I want to keep doing these. I want to do aesthetics. So to me, in our field, I think aesthetics has, for me anyway, going back 7 years, a bit of a negative connotation. I never thought of myself as doing aesthetics. That really wasn't my forte with them I was good at. But I can tell you this, your patients want aesthetics, and they're going to come to you first if you have this. And so the thing that changed my mind about aesthetics in my practice was I was talking to patients before I got Morpheus, and I said, would you come to my office? Would you pay me $500 to treat fine lines and wrinkles and aesthetics around your eyes? Would you pay me in an optometry clinic to do that? And they would say, yeah, I'd pay you, sure, I'd do that. And then about the third patient I asked, she goes, listen, I come here and I trust you with my eye health. Of course I want my eye doctor to do this. Of course you're the person that's got the specialized, the understanding of the eyes, the lids. I would definitely come to you to get this. And I started to realize we have a built-in advantage here. Patients trust us already. They come to us on a regular basis. They know we understand the eyes and the lids and the skin around the lids. They're going to come to you if you have the technology, and if you promote this in your office to them, they're going to come to you.